Hey, community, we're back, and I'm Brandy B, the community MP.
And I'm Brandy G, the community NP.
And together we are
B&B, the community MPs.
So, B.
Yes.
What are we talking about today?
All right, so we're going to talk about trichomonas.
Okay.
So trichomonas, it's a STI or STD, which that stands for what?
Sexually transmitted disease.
So how do you get it?
Or sexually transmitted infection. You get it by having sex.
What type of sex?
Unprotected. With an infected person.
Okay, but what type?
Oral.
Okay.
Can you get it oral?
I'm sure you can.
I'm sure you can too. Or vaginal, rectal.
Okay.
Any type of sex.
Okay.
Any type of penetrating sex.
All right, so let's talk about trichomonas. So trichomonas is an infection caused by the protozoan Trichomonas vaginalis. I think I'm saying it right, okay?
And even though that word has vaginalis in it, it sounds like vagina, men can get it.
Yes, they can get it also.
Yes.
So it's one of the most common non-viral infections, STIs, okay? Because viral STIs is what, like herpes, what else?
HIV.
Is it HIV? What else we have that's viral?
That's a STI?
Yep, that's it.
Yeah.
All right. So women are more common than men to get it, but men can get it. Usually when they get it, they're asymptomatic.
Yes.
So usually when a woman comes in and has some type of vaginal complaint, more than likely it's usually either trichomonas, BV, bacterial vaginosis, or yeast infections.
Yep.
So it's in that class of one of the common vaginal complaints from women, okay? A lot of times in men, they can get it, but most times, like we said, they're asymptomatic. So they're passing it around. Basically.
Without knowing.
Yeah. All right. So let's talk about screening.
What about it?
You want to know about screening, Brandy? So who should be screened? So usually with STIs,
you should at least get screened at least once a year.
Yes. So I know that it says that HIV infected women should get screened at least once a year, and if they're pregnant, they should get screened prior to their during their prenatal visits.
Okay.
Their first prenatal visit, they should get screened.
Like that's women with HIV.
Yeah. So what about someone who may have multiple sexual partners? Would you recommend they get screened?
They get screened. Yes.
Okay.
Yeah.
Okay.
So, but anytime that you feel like you're at risk, or you've been exposed, or you had unprotected sex, you should get screened.
So one of the things I thought was interesting is that screening is not recommended in men.
Oh, really?
No, yeah. It wasn't
Even though they have it and they're asymptomatic?
This is not recommended
We
in
need
men.
to change the rules.
I know. I think everybody should be getting screened.
Yes.
All right.
For everything.
So, Brandy, I want you to tell us something about some of the signs and symptoms of trichomonas.
So, in acute infections in women, they may have like vaginal discharge. It may be like thick, pussy looking.
Okay.
It may have an odor. They may have, and then the discharge can be thin. They may have burning.
Okay.
Dysuria, urinary.
What's dysuria?
Like it burns when you pee.
All right. I just don't know what that is.
Yeah.
All right.
Increased urinary frequency, lower abdominal pain, and their what is it?
They don't know what that is, so tell them what it is. It's pain with intercourse.
Yeah, painful intercourse.
Yes, you're trying to give y'all all the medical terms.
Oh yeah, I forgot.
We gotta keep it. This is our community, okay?
I'm sorry, community.
Yes, okay.
Painful intercourse.
Also, if you're on your menstrual cycle, the symptoms may, be a little worse on your menstrual cycle. Like we said, and women may get some pain after some sex. Bleeding.
Yeah, after
some bleeding
sex.
after sex intercourse.
So what if you have like this chronic trick, what might you see?
So sometimes when you had it for a while and you may have not known that you had it, the symptoms may be milder, actually. You may just have some itching. You may have some pain on intercourse.
Is that because the body is adapted to it, or what?
I don't know.
I don't
know. Or you may have a scant discharge, maybe like a little slight discharge in your underwear or on your panty liner.
Maybe that, and people don't notice because they've had it so long that they think, oh,
it's
this
just
is
a regular.
normal.
Yeah, okay. But the interesting thing was most people are asymptomatic. There's like 70-80% of people are asymptomatic, but at some point they may start to develop symptoms. But at some point they're asymptomatic.
That's women and men.
Yeah. Okay. So tell me about some of the symptoms in men.
So if they do, like we said, most are asymptomatic.
Okay.
They may have like a discharge from their penis. They may feel burning when they urinate. A burning sensation after sex.
Okay.
And then I think that's pretty much.
Yeah.
pretty much it for men.
And some itching.
Itching.
Some mild itching.
Yeah.
Okay. So, and one thing that I did see was men, it can cause like prostate problems, infertility.
Mm-hmm.
I guess if it goes untreated for a while,
long time,
it may cause those complications.
Even prostate cancer.
Yeah.
That's crazy.
I don't know how
common.
Yeah, it is.
Probably not very common, but I guess if you go a long time without it being treated.
Yeah. Okay.
All right. Good.
So how do we diagnose trichomonas, Brandy?
We can diagnose with a urine, or with like a swab.
Do men get swabs too?
Can they?
Yeah. I'm just asking. The community wants to know, Brandy.
Oh, the community wants. Yes, men can get swabbed. So, like, if the man has discharge, then you can swab the discharge from the penis, from the opening of the penis, and then send it off to the lab.
Why are you doing this? That's how you be swabbing.
Out here just swabbing.
So I remember trichomonas because I remember when I was in, I think I was in nursing school. Or it could have been NP school. So my preceptor, she would do a wet mount? Yeah, wet mount of the discharge.
What's a wet mount?
So it's when they take the secretions and they put it on a slide and they put some solution on the slide and you look under the microscope and you can see the bacteria. And you can see the flagella. It was moving. Yeah. Like you can see the tail of the trichomoniad moving. So she was like, see that? Trichomonas.
Yeah.
So that's how I always remember trichomonas. Yep. So you also can do that test for diagnosis also. So how do you treat trichomonas?
Medication.
Okay. So what's one of the common medications they use for it?
Flagyl. Yeah. I think that's the most common that...
Yes. And that's the one you're not supposed to drink, right?
Right.
Alcohol? Because what happens if you drink alcohol?
You get really, really sick.
You can go wind up in the emergency room. Yes. And so I know that practicing years ago, it used to be oral flagyl, or you can do the Metrogel, called the Metrogel.
Oh, yeah.
Yeah.
That was a long time.
Yeah. I've been an MP for a long time. So, but now I see that it says that the Metrogel,
is it not as effective?
Yeah, it's like less than 50%.
Oh.
Yeah. And people who like to drink, they would ask for Metrogel.
Oh,
Just push it up your vagina and insert it in your vagina.
And you don't get sick. You can still drink.
So, they would ask for Metrogel, but it says less than 50% effective. So, and also, pregnant women and women who breastfeed, they can be treated with the flagyl, but they have to be treated for a longer period of time, like 7 days. Yeah.
That's interesting.
I know.
So, I'm just curious now, like all those people that got treated with Metrogel, hopefully they ain't still out there with 50% of them might be out there with trichomonas still.
And this information came from Up to Date, so usually it's up to
to
date.
Yeah.
All right, so when you get treated with the oral medications, take your medicines. Brandon, should they take all their medicines?
All of them.
So what if I take some of my medicines, take it for like, how do you treat it? How many pills? It's not that many pills anyway. What? It's a gram, right? Is it 2 grams or a gram?
I think it's 2 grams.
It's 2 grams. Yeah, you're right. It's 2 grams.
So that could be 4 pills.
So what if I only take 2 of my pills and I give my partner 2 of the other 2 pills?
Y'all still need 2 pills each.
Okay. So that's not going to cure us?
No.
Okay.
You got to take all of them. Whatever the prescription is that you're given, you have to take the exact amount.
But what if my partner needs to be treated too?
Your partner needs to be seen by a healthcare provider and get his own prescription or her own prescription.
Okay, I was just asking. Just wanted to know.
Good question.
I wanted to know.
Good question for the community.
Yes. Let's see. So how can I prevent? I don't want to get trichomonas. So what can I do to prevent myself from getting trichomonas?
I don't want you to get trichomonas. So
I don't want to get it either.
The best thing I can recommend for you to do is
what?
Abstain from having sex.
Okay.
Or wear a condom.
Okay. But condoms don't feel right.
Sorry.
Wow.
Neither does trichomonas, so I hear. So you choose your pills.
So that's really what you need to do just to prevent from
abstinence or
wearing condoms.
And if you are out there having sex, with multiple people, or you don't even have to be having sex with multiple people because your partner could be having sex with multiple people and put you at risk. So just get screened.
Okay.
Yeah.
So where can they go to get screened? Do I have to go to a health department?
You can go to your primary care provider.
Okay.
You can go to the health department.
Okay.
Emergency room, urgent
Don't
care.
You send them to no emergency room to go get screened for no trichomonas.
There's a lot of places.
That is wasting a lot of money.
It's a waste of money, but
no, don't do that.
It's an option.
Yeah. Don't go to the emergency room, y'all. No, go to urgent care. Go to your PCP. Go to
urgent care expensive too.
Yeah.
Go to the health department. That's
Yeah.
or your primary care provider.
Or you may have a nonprofit organization that may screen for STIs in the community, so you can always go there and get screened also.
Very true.
Yep. All right, so that's Trichomoniasis. That's Trichomoniasis in a nutshell.
Trich. What's known on the streets as Trich.
Really?
Yeah. You don't know the slang? The street slang? There's clap, clam, Trich.
No, I didn't know. I heard clap.
High five. HIV.
Oh, I never heard that.
You haven't?
Oh,
Well, when I
I'm slow. Oh.
When I started working at Parkland, that's when I learned about high five. I was like, they'd be like, oh, they got high five. And I'm like, is that like?
I never heard of that one. That's all right. I heard a clap. I think I heard people say trick, but that's it.
Yeah. Well, now you know.
Yes.
But yeah, so disclosure.
This information is for just knowledge only, to share with a family and a friend, to spark a conversation. It does not replace you going to see your primary care provider, period. So we do want you to see your primary care provider at least once a year. Okay? So B, where can they find us?
Facebook, Instagram, YouTube, email.
Okay. Anywhere else?
Facebook, Instagram, YouTube. I think that's it.
Email. Not TikTok?
We ain't on TikTok, girl. We ain't that trendy. But I mean, we might hop on there. You never know. But yeah, so yeah, follow us, like, share, subscribe.
Yes.
Give us feedback. Let us know what you want to learn about. And why do we do this, Brandy?
Because community is our beauty.
It is. All right. Have a great day, y'all. Bye.